Barbara Howarth.
Yes.
Hello, Dr. Galloway. Pleased to meet you. So, I've had a letter from your doctor. That you've been having some trouble swallowing.
That's right, I have, yes.
Okay. Can I ask you to tell me about this? What's happened?
Well, it's been coming on over quite a long time, actually. And it's just got worse and worse as time's gone on, and now it seems to be all the time, every day, every time I eat, every time I try and drink anything, it's
So you say quite a while. How long do you mean over?
I'd say probably before Christmas, so I'd say about 6 months.
Okay. And what is it you've been noticing? You've been having trouble swallowing?
Yes. When it first goes down, I can actually physically swallow it, but then it really sort of hurts, after a bit. It sort of seems
so the actual, when you have something to eat, the actual swallowing seems to work?
Just, at first, and then it just all seems to not go down properly.
Sort of roughly, where do you mean? Do you feel it sticking in?
I get pains down here.
Mm. When this started, sorry, I was going to say, is this just with solid food, or do you have the same thing if you're having a drink as well?
Just anything, yeah.
So liquid?
Yeah.
And is that right from the beginning, when it first started occurring 6 months?
I just had trouble with both.
Okay. And this has been getting gradually worse. You ever had anything like this before?
No.
Anything you can do to try and help it go down?
Well, sometimes, if I sort of push myself back, just push out and move chin up, and that it will go down a bit better.
Okay. And when you're eating, the discomfort you're getting, how long does that come on off? Is it immediately while you're eating, or is it some while later?
It's after the first few mouthfuls, really. So it's it's as I'm eating, as I'm trying to eat, and it's I just can't eat properly. It takes me ages to get any sort of a meal down me at all.
What's your weight doing?
I think I've lost about 2 stone, something like that.
Okay. You've lost quite a lot of weight then.
I have, but I haven't really been trying either. So.
Yeah, okay. So you're just not eating as much. You just can't.
No. Well, it's such a strain to eat because it just hurts, and I got all this heartburn and stuff with it.
Yeah, okay. Is the heartburn since this has all started, or is it something you've had for years?
No.
Have you ever had any regurgitation of food?
Well, to be honest, that's one of the things that took me to the doctors. It's about a few weeks ago now, probably just before I went to the doctors. I brought up some of my tea in the night.
Okay.
And I brought it up. Like normally, if you're ever sick, it's sort of like, it's sort of digested food and everything. Well, this was whole stuff. It was undigested. It was really awful.
Right. Okay. Right. What about any other symptoms you've noticed? Hiccups?
I've been getting hiccups, regularly for the last year, really.
Okay.
Just every day. It's driving me crazy.
Okay. Another question, it may seem a bit unconnected. Have you ever noticed any changes with your hands, with the skin in your hands, or that your hands change colour in cold weather?
No.
Tightening off the face around the mouth?
No, nothing like that.
Dry eyes, dry mouth?
No. I don't particularly like the cold, but I haven't noticed anything like that.
Okay. What medical problems have you suffered with in the past?
Well, I'm asthmatic.
Okay.
I mean, it's only mild, but I've had it a long time, And
How long have you? Since childhood, or?
No. I was in my 20s. I had 2 or 3 attacks, really. And I'd ended up in hospital one of the times.
Okay.
And they put me on nebulizers.
Did you have to go to intensive care? Or
No. They sorted me out on the ward, but since then I've had to have inhalers and things. And,
Okay.
I mean, I don't use the brown one much. It's at home but I do carry the blue one with me.
You've got salbutamol inhaler. Okay. When was it? How long ago since you needed any sort of hospital admission or steroids?
I just went in the once.
2 years ago. Okay.
Yeah. I mean, I've got the brown one, and I only use it.
What about any
occasionally.
other health problems you've had in the past?
Well, I went in hospital. When was it? About 19 years ago, I think, 1920. I was 41, so 19 years ago. One of the moles on the back of my leg went cancerous, I suppose. They said it was one of the worst kinds as well.
You know what? Skin cancer?
Yeah.
Melanoma? Or?
Yeah.
Okay. And how was that treated?
Well, they took it away and gave me some treatment, and they said it was fine afterwards. They said I was cured.
Okay. Okay. What about any other health problems? Diabetes, high blood pressure?
No.
Do you ever have rheumatic fever when you were a child, or tuberculosis?
No.
Okay. And what medication do you take regularly? You said the salbutamol.
Yeah.
Anything else?
Well, to be honest, recently I've been buying these tablets from the chemist, Zantac or something.
Okay. Did they help?
Yeah. Well, sometimes I have to have quite a lot though in a day. Because it's been so bad recently.
How many are you taking a day?
Well, sometimes it's like 1 or 2 tablets, but 3 times or something like that.
Okay.
On the worst days it's like 2 tablets 3 times a day. It's sort of not always helping that much.
Any other medication from the chemist not
No.
prescribed from your doctor? Any allergies?
No.
Okay. Any family history of any medical complaints?
I can't think of anything really.
Any family history of particularly anything like cancers or?
No.
Okay. And do you smoke?
No, I don't.
Do you drink alcohol?
Not very often, no. I mean, sometimes Jack and I will go out, but only with friends, really. We have meals at people's houses and things like that.
So how much do you drink a week, roughly? Do you know the weekly
not
limit?
even in a week, really.
No, okay. Well, and who do you live with?
My husband.
Live with your husband. Do you work?
Yes, I work in an office.
What do you do?
Well, I'm an admin. I work in a solicitor's office, doing all the admin and things,
Right,
and
okay.
inputting and doing the, tying the wheels and putting that ribbon on
Yep.
and stuff like that. all the bits and pieces and make their job easier.
Okay. Were there any other particular things you wanted to mention to me?
I don't know. It's just. I mean, this thing with the bringing up the food and everything and the pain not going away, it seems just to be getting so much worse. And I wondered what it could be. Whether it could be anything serious, really. I suppose.
They've been on your mind a lot, or?
Yeah, I mean, because it's constant. It's every day, all day. Every time I try and eat or drink anything. I say at first it wasn't as bad as that. It was only like occasionally, but then it's just every single day I'm feeling like this, and I just wonder what's happening. Okay.
Well, we need to obviously get to the bottom of it. If I just go over things with you again, just to sort of recap what you've told me, check I've got everything right. So you've been having trouble getting food down for about 6 months.
Yes.
And it's been getting gradually worse.
That's right. Yes.
You've lost a couple of stone in weight this time. And am I right in that this has been as bad for liquids as it has been for solids? So you're finding a cup of tea is just as difficult to get down?
Yes, and I like my tea.
Right, okay. And you sometimes find that sometimes moving your body about and getting different positions can help?
Yeah, I mean, if I can stick my chin up a little bit, or sort of move my chest out, sometimes it's sort of, I don't know whether it sort of clears the gap or whatever it is where it goes, I don't know, but it helps a little bit.
And you've had one episode where you brought food back up during the night?
Yes.
Okay. Well, I think you're absolutely right. Your symptoms are very worrying, and I think we need to get some investigations to find out what they are. There's a variety of conditions that can cause trouble with swallowing, and there's a condition which is actually a problem with the way the gullet contracts and the way it can pass food through. And I wonder that some of your symptoms sound like that might be what this is.
Right.
So a condition where the muscles are not contracting as they should do, which very typically can cause this problem with swallowing liquids and solids alike.
Mm-hmm.
You said, could it be something more sinister? And well, it could be. You've lost a lot of weight, and it's certainly something we need to look into. Although more commonly, when people have that type of problem, it's a blockage that means you struggle with the solids, but the liquids normally go down easier.
Right, achalasia both, you see.
Which is less common with that sort of problem. But I agree that I think we need to look into it quickly and try and make a diagnosis one way or the other. I think we ought to do some blood tests. Well, I think that the first thing is I need to take you next door and examine you fully. But I suspect to diagnose this, I'm going to need to do some additional tests. I want to do some blood tests, and I'll do a sort of a bit of a screening panel, particularly looking for example, signs of anemia in your blood.
Right.
The other thing we need to do is some form of scan of your chest, and the first thing is to do what's called a barium swallow. That's a test where you come up to the X-ray department and they will give you a drink to swallow, and you need to do your best you can to get that down. The drink they give you will then show up on an X-ray, so when we then take an X-ray we can see what's happened to that drink you've had. It can be quite unpleasant to drink, particularly if you've already got a swallowing problem, but it's also a very good way of telling the diagnosis, and I think that's the first test. Depending what that shows will depend what we do thereafter. But probably, whatever it shows, you'll need to get treatment from an expert. So rather than seeing me in the general medical clinic, I think you should be seen by one of the experts in the appropriate department. This condition of the swallowing I've talked about is called achalasia. Right. And that's a condition I'd ask one of my gastroenterology colleagues, one of the stomach doctor colleagues to see you about.
Would you write that down for me so I can remember?
Yeah, sure. I can give you some written information about it, actually.
Okay.
So I think rather than me making an immediate follow-up appointment with you, what I'll do is we'll get the tests done. We'll get a date for that barium swallow sorted out as an emergency. So we'll get that done within hopefully the next week, but certainly within the next 2 weeks. And with that result, I will then get you to see the appropriate person. And I can give you some information about the test itself today, and also I'll write down achalasia and give you some written information about that.
And do you think that's more likely than cancer?
I do. I think the most important thing is we get the tests done. If I knew what it was now, I wouldn't be doing all the tests. Right. So although I'd like to be reassuring, but I think you're absolutely right to be concerned, and we do need to look into this quickly. Okay.
Okay. Thank you very much. Yes.
Have you got any other questions you'd like to ask?
I don't think so. No, I'd like to just know as soon as possible.
Yeah, absolutely. Okay. We'll get the test done. Okay. All right. Thank you. So this is the discussion for the history station. Barbara Howarth, a lady who presents with dysphagia. So dysphagia is immediately a red flag symptom, particularly in the association with weight loss. The immediate concerns of sort of an underlying malignant process called esophageal narrowing. In this case, there were some features in the history that suggest an alternative diagnosis, however, particularly the dysphagia being equally affecting liquids and solids, which is something quite characteristic of achalasia. That associated with the positional nature of the dysphagia, the repeated hiccups would also support that diagnosis. When you're taking a history from dysphagia, it's also important to think about other possible causes as well. For MRCP exams, always remember to ask about Raynaud's phenomenon, symptoms of scleroderma, tightening of the mouth. Anytime you get someone with red flag symptoms, you need to, even if you think this may be achalasia, you still need to follow that sort of very urgent investigation to 2-week wait to make sure you're not missing a malignancy that needs much more rapid assessment and treatment.